What's up, everybody? It's me, Drew Manning from Fit2Fat2Fit, coming to you live from my kitchen really quick to talk about blood work. So I'm going to let Facebook build an audience really quick because I don't want to dive into these numbers just yet. As you see behind me, there's some numbers right here. We're going to reveal all the numbers of my latest blood work that I just got done, and I'm going to be talking to you about why these are so important. But first and foremost, just want to say hi. If you guys are on, make sure you say hi in the comments so I know that you're here. And give me some thumbs up, give me some hearts, because here's the thing. So when people ask me if eating all that fat, does it clog your arteries, does it raise your cholesterol, does it increase chance of heart attack? We've been taught this for so long. We're going to dive into all of this on whether or not keto, clogs your arteries or causes heart attack or all that. There's a lot of myths that go on about the keto diet and eating all that fat. And if it raises your cholesterol, we're going to go into all the numbers right here, right now. So if you guys are jumping on, say hi, say where you're from really quick. What's up, everybody? We got a lot of people from all over the world right now, people doing keto. I'm going to talk to you guys and dispel some myths, and I'm going to show you guys my blood work just so that you guys know that keto, eating a lot of fat, does not mean that you're going to be unhealthy, that your arteries are going to be clogged and you'll die of a heart attack like we've been taught. So really quick, I'm only going to go over some of the numbers of the most important markers, but here's the thing. When it comes to blood work, you guys, if you are getting your oil changed more often in your car than you are getting your blood work done, you have a problem, because you don't know what's going on inside your body until you go get your blood work done, right? You might feel good, you might even look good, but it's important to get your blood work done on a consistent basis. I would say once every 6 months at a minimum, so that you know where you're at. So you know if your lifestyle, whether you're doing keto or vegan or vegetarian or paleo, whatever it is, if you know that's healthy for you. So I can't stress that enough for you all to go get your blood work tested on a regular basis so that you know if what you're doing is working for you and if it's healthy for you. So anyways, with that being said, I won't preach too much, but with that being said, let's get into the numbers, shall we? You guys ready? Are you guys ready to talk about, oh, you can see some of those numbers. Oops. So we're going to talk about some of these numbers up here on the board, and then we'll go over maybe some questions you guys have at the end. But I wrote them down up here on the board, but I have them right here in front of me just in case you guys have some questions about some stuff. My friends from Green Wisdom Health, you'll see them in the comments. Dr. Lewis and his wife Janet are going to be on here as well answering your questions. So if you guys have questions about blood work, check my friends at Green Wisdom Health. Dr. Lewis is going to be on here answering your guys' questions about some of these numbers over here. So Green Wisdom Health, if you guys, I had them on my podcast recently. They're from Texas. Basically, the way it works, if you want to get your blood work done for cheap, right? Because it can be expensive getting your blood work done. If you want to get done for cheap and have a doctor go over the numbers with you and diagnose what they mean in an easy to understand format, check out greenwisdomhealth.com. I can't stress the importance of having a doctor go over it with you that knows what they're talking about. So Green Wisdom Health, Dr. Lewis is going to be on answering you guys' questions. So if you guys have questions in the comments, they'll be there to answer them. So let's get started with the numbers, shall we? So hold on, let me see. This is backwards. Let's start out with total cholesterol, right? We think cholesterol is the end-all, be-all of whether or not we're healthy. If you have high cholesterol, you need to get on medication, otherwise you're going to have a heart attack. First of all, simply it's not the case. If you read the book, I highly recommend Cholesterol Clarity by my friend Jimmy Moore. If you want to understand more how cholesterol works in the body and why this number is not the end-all, be-all of whether or not you have a heart attack. So my total cholesterol is 161, which is actually kind of low. It's not too high. You'll see HDL, which is classically known as good cholesterol, came in at an 80. For me, that's an all-time high. 80 is pretty high for me, to be honest with you. And but for the most part, it's good, right? I back in the day, when I got my blood work done, I would be in the 30s or 40s. Right now, my HDL is the highest it's ever been, and it's at 80. But the important thing to look at is total cholesterol is 161, HDL, good cholesterol is at 80. My triglycerides, this right here is really important, right? The fat that's floating around in our blood, This right here is low, and that's where it should be. Anything under 100 for the most part is good when it comes to triglycerides. You want them to be lower, okay? So even though I'm eating a lot of fat, that doesn't mean that it's clogging my arteries and I'm gaining fat, right? I'm not going to take my shirt off for you guys, but you guys just have to trust me that, you know, there's not a lot of fat underneath here. But triglycerides right here is really important. 46, really happy with those numbers, to be honest with you. And then my LDL, which is, you know, known as my bad cholesterol, is 68, which is actually really low. And I probably want to work on getting that higher. But just so you guys know, I'm eating things like butter, coconut oil, goat cheese, fatty meats with lots of saturated fat on a daily basis for the past probably 3 years, you guys. And to see these numbers, my LDL, my triglycerides, my HDL, be where they are is really, you know, in my opinion, eye-opening for a lot of you who think that maybe, you know, a keto diet with a high fat is going to clog your arteries and raise your cholesterol to where you're going to have a heart attack. That's simply not true. There's a lot of other factors that go into this. Obviously, I'm a very, you know, healthy individual. I work out every day. So that factors in as well, other lifestyle choices. But I don't want you guys to think that keto is going to cause you to have a heart attack. But anyways, let's move on, shall we? Glucose, fasting glucose 81. That's pretty good. I was fasting when I did this. And by the way, this was as of February 22nd. That's when I did this. So not too long ago. So you guys, just so you guys know. So these numbers are from pretty recently. So glucose 81, hemoglobin A1C, which is an indicator of whether or not you have type 2 diabetes. Oops, that should be 4.9%. Hold on a second. 4.9 right here. Anything below, I think 5.7 is, you know, there's no pre-diabetes or anything like that. Let me see if I can find the reference range, but I believe it's 5.7. Dr. Lewis can comment on that as well. Let me just make sure here. It's in here somewhere. Hold on a second, you guys. Be patient with me. The reference range, hemoglobin A1C is, maybe I didn't put it in here. It should be in here. Or maybe I dropped it. I might have dropped it. Anyways, 4.9%. Obviously, I'm not diabetic. So that's what hemoglobin A1C is in a nutshell. Insulin is actually kind of low. It's 1.7, but I'm not too worried about that. My HSCRP, which is inflammation in the body, which if you guys you know, start to do your own research and learn that heart attacks aren't caused by eating fatty foods or having too much fat. It's caused by inflammation, right? So this is my cardiovascular risk right here. It's pretty much non-existent, less than 0.2. So very, very low. I know you guys can't see that from that far away, but inflammation is what we're battling here more than anything else. Inflammation is caused by lifestyle choices of eating things like processed carbohydrates, or too many processed carbohydrates, not exercising, a lot of other lifestyle choices. And the last one I want to put on there is vitamin D, which is 86, which is really good. I do supplement with vitamin D3 and K2, about 10,000 IU per day, but that's what works for me. And I make sure and take it with some fat. So I usually have it with my bulletproof coffee in the morning. And I'm actually absorbing it because it's a fat-soluble vitamin. So my vitamin D is at 86. Obviously, I did the full panel of blood work. My blood health is good. My red blood cells, white blood cells are all good. I won't get into the hormones, but just in a nutshell, so you guys know, my thyroid is functioning. My testosterone levels are at a healthy level, not too low, not too high. Pretty happy with that. My liver health, the only thing that I had an issue with was AST, and I don't really know how to explain that. Dr. Lewis from Green Wisdom Health can explain maybe what AST is, but I'm not too worried about it. You know, my liver definitely needs to be taken care of. I don't drink a lot of alcohol, maybe once or twice a week at the most, but my kidneys, you know, for the most part were good as well. My electrolytes were on point. But I want to go over these numbers because these ones are the most important ones. In my opinion, they're the ones that you guys can pretty much get tested anywhere you go. Like I said, if you go to greenwisdomhealth.com, you can get access to my doctor friends, Dr. Steve and Janet Lewis, who can, so basically how it works is you go to Ulta Labs. Ulta Labs usually is anywhere, around the country. It should be close to you. You can go in, draw your blood, it gets sent in. It actually really quickly, the results came back fairly quickly, like within, some of them within the first day, some of them within 2 to 3 days, like the hormones, those ones take a little bit longer, but it didn't take long at all. And then you just have a consultation with Dr. Lewis, and then he sits down and tells you what each number means and how to diagnose it and what to change in your lifestyle and what to add in, like what types of foods and supplements to help with these numbers. Because at the end of the day, it's not just about weight loss. It's not just about looking good. It's about being healthy on the inside. And unless you know what your blood work is, then you're just kind of shooting in the dark. So even though I might tell you keto is good, or someone might tell you vegan is good, or you watch the documentary What the Health and you stop eating animal products, that's fine and dandy. But these numbers here, for the most part, don't lie, and you need to go off of what's healthy for you. And the only way to know that isn't by stepping onto a scale. It's by knowing what these numbers are right here, and then from there making adjustments in your life to make sure to get these numbers to optimal levels. Because most doctors will say, oh, you don't have a problem because you're not in the danger zone, but there's only like a little number that's separating you, might be separating you from the danger zone. So most doctors will be like, oh, you're not there yet, so we won't worry about it. But once it's there, then it's like, okay, here's some medication for you. So let's try and work on preventing disease rather than waiting till we have something and then taking prescription pills to hopefully, overcome that situation. But anyways, I wanted to share with you guys my numbers to show you that, eating lots of fat does not mean that it's unhealthy for you. For me personally, obviously it's very healthy for me with what I'm doing. I do keto for the most part, maybe 80 to 90% of the time. And then, I right now I probably am in more of a mild state of ketosis where I'm eating probably 50 to 70 grams of carbs per day. So I'm probably not high levels of ketones like I used to. I used to be really hardcore keto all the time and really cut down my carbs. I'm probably in the 50 to 70 range, but I feel great. And these are my numbers right here. And there's definitely room for improvement in some areas, but for the most part, it's I feel good. I feel like I look good. And I want you guys just to take control of your health by getting your blood work done and becoming your own self-experimentation. So what I would recommend is maybe try keto for 30 to 60 days or, whatever protocol you want to follow, and then get your blood work done, or get your blood work done first, try it out for 30 to 60 days, come back and get your blood work done again. And I know that this stuff costs money, but at the end of the day, it's an investment. Your health is an investment, right? And so I think you're worth it to spend the money to find out what your numbers are so that you're going to be around for a long time for your kids, your grandkids, and just to live a full life where you feel optimal rather than just barely making it through and just, give me all the pills to mask these symptoms. But my goal is for you guys to kind of take control of your health. And this starts right here by getting your blood work done. Like I said before, if you are getting your oil change and your carb more often than you're getting your blood work done, there's probably an issue. And so really important to get your blood work done on a consistent basis. Check out my friends at greenwisdomhealth.com if you want consulting with these numbers rather than just getting sent the numbers and you trying to interpret them yourself so you understand what they mean. So anyways, with that being said, let's see. There's all kinds of questions here. Dr. Lewis is doing a good job of getting back to people, to be honest with you, because a lot of these questions are questions for Doctor. And so anyways, I'll let him handle some of those. But let's see. Yeah, there's a lot of other questions that I can't answer on here. But anyways, I just want to share with you guys, be transparent with you to show you guys what I'm doing. really quick, if you guys are still listening, which a few of you are, I will be in San Diego tomorrow through Sunday at Fitness Business Summit, so I hope to see some of you there. And then the next week I'll be in Kona, Hawaii on the Big Island. The 22nd through the 27th, I'll be doing the Lava Man, which is on the 25th. And really would love to see some of you there at the Lava Man Triathlon, where I'll be attempting to do an Olympic distance triathlon. We'll see how I do, you guys. I've been training for this one. So really looking forward to it, and really appreciate you guys jumping on here, letting me share my numbers with you guys. So remember, focus on health first, right? And then let weight loss and looks be a byproduct of living that healthy lifestyle over time. You're worth it. Don't give up, and learn to love yourself where you are now as you work on a better version of yourself. So much love, much respect. Thank you guys. We'll see you guys next time.